Hey, great Monday evening. It is a beautiful evening in the city of Brownsville. Let me tell you, finally, I think that yeah, we crossed over the mountain of winter, and we're starting to get back to normal in the city of Brownsville in regards to our usual warmness here. Ya pueden empezar a esconder, alzar las San Marcos and the fur jackets. Y ya, tómense todo el café, el chocolate abuelita que tengan, porque ya, no more cold weather for us here in the city of Brownsville. It's a beautiful evening, and it's even more of a beautiful evening because we have with us el doctor Carlos de la Garza. Dr. Carlos de la Garza is a neurology resident at Baylor College of Medicine. Dr. de la Garza, thank you for being with us tonight.
Oh, thank you for having me.
It's always an honor, and one of the things, Doctor, that we make mention is, we're very, very appreciative here in the city of Brownsville, in the surrounding cities, surrounding areas, for the dedication and also the accessibility that a lot of our medical staff here in the area have. As that, they've shared their time, and one of the things that we've shared is, y'all's time right now is very, very, very valuable. But we appreciate, that y'all take time out of y'all's busy day that, you might have to rest to come and inform individuals on any of the questions or concerns that they may have. So, again, thank you. Thank you so very, very much. And again, as we mentioned, Dr. De La Garza is stationed up in Houston, Texas. Dr. De La Garza, how is Houston doing with COVID-19 at this time?
I mean, it's in the last couple of weeks, it's been somewhat stable, I should think. But just to give you an idea, the hospital, or one of the main hospitals I was working at, has about 10 to 12 ICUs just for different things: surgical ICUs, medical ICUs, so on and so forth. And about 4 of those ICUs have been converted back to COVID ICUs. There was a point where it was at its worst. I think we were up to 6 or 7 ICUs around there. Each ICU holds between 10 and 15 people, some of them even 20. They ended up going down to 3 people when the pandemic was sort of getting under control, but then things sort of spiraled out of control again, and we ended up having to open up more. And now they're at 4, last I checked.
Well, one of the news that we've been getting, is that here in Texas, the hospitals are reaching that capacity again. And a lot of it, I would say, and I think the concern is that a lot of individuals were out there traveling during the holidays. And I guess it was sort of expected, no, Doctor?
So I imagine, I guess we could say it was sort of expected, but even since before Thanksgiving, things were already starting to go up. I don't honestly don't know if it was because people were kind of letting their guard down, or what exactly happened, but before Thanksgiving, things were starting to go up. In fact, it was about that time when they started opening up extra ICUs for COVID patients.
Yeah. Laura says there was a flyer put out today that they might close bars in several counties in and around Houston. Again, it may be that a lot of these places have opted to close because of the same thing. It's not a good thing. I'm not sure. I haven't seen anything in regards to any orders. I think because of the governor's mandates, it's going to be kind of hard to close down anything in the state of Texas right about now.
Yeah, they have some kind of issue going on in the county with the county judge versus like the governor or something, where they're kind of going back and forth. So I guess things are at a stalemate right now. Most of the people are wearing masks and kind of keeping to themselves, but you do get reports of clubs being pretty much all the way up to the brim and just full of people, no mask, no distancing, no nothing.
Thank you. Una pregunta: a los que nos dio COVID, ¿nos pueden poner la vacuna? Porque lo que sé es la vacuna son anticuerpos y eso ya lo tenemos a los que nos dio.
La vacuna no es, las 2 vacunas que están ahorita, que están aprobadas, que es la de Moderna y la de Pfizer, no son anticuerpos en sí. son, la mejor analogía que podría dar es, son un instructivo para que tus células hagan proteínas que puedan ayudarte a reconocer al virus, y lo cual obviamente te ayudaría a protegerte, pero sí recomendado que personas que ya hayan tenido la infección se vacunen de nuevo, porque también hay varios reportes de personas que se han infectado 2 veces. Este, entonces eso es la recomendación de ahorita, que si se pueden vacunar, que se vacunen independientemente si hayan tenido la infección o no.
Pues una de las cosas es de que existen al momento las dos vacunas, Pfizer and Moderna. And
Ujú.
I think AstraZeneca is also coming out with a vaccine. And there's also another one. Oh, again, there's a trial one that I've actually signed up for with Johnson and Johnson. All of these, there are 2 doses to these. Why is it that we have to take 2 doses to these vaccines, doctor?
So just going back a little bit on that comment, that like you said, the two that are approved right now, Pfizer and Moderna. But I think as of tonight, maybe a couple of hours back, Mexico gave emergency use authorization for the AstraZeneca vaccine. So that's pretty new. But basically, the reason that we need two doses is one's acting as a booster, so to speak. So sometimes when you get a vaccine, you have to get a couple of doses when you're a kid, then when you grow up. Um, for example, the pneumococcal vaccine, you get 2 doses if you're an adult. So it's just pretty much to boost. But as of yesterday, they're starting to trial to see if giving a half dose would be just as effective as giving the full 2 doses.
So it is. There's going to come a point in time where the 2 doses won't be necessary, or is this the new norm for us?
So that's kind of up for well, not debate, but up for study right now, because part of the time, or part of the process to get this vaccine approved was to kind of foresee every kind of way they could administrate that vaccine, meaning a lot of patients would get 2 doses, some patients would get 1 dose, and if you were to get 1 dose, you'd get different doses within that dose. So let's say, for example, with between the two vaccines, you get a total of 200 micrograms of vaccine, right? So if you get 1 dose, you'll get 100. But if you get half that dose, you'll get 50 or 25 and so on. So what they're trying to figure out right now is if with one vaccine you can get enough immunity to protect you from the virus. And during the research phase, there was a time when there was a cohort of patients that did get half a dose to see how they responded, and they seem to have developed some immunity, but that's still up for debate.
And let me ask, one of the things that I think that we've experienced in the news as of recent was that now more children are starting to pile up in the hospitals with COVID related cases. If this is the case, then has everything that we've been told in regards to children being more able to fight off the virus, as they're not true? And is there anything out there in the works to protect children in cases that we need to vaccinate them?
So regarding the Moderna vaccine, that one's for people 18 years and older. Pfizer's 16 years and older, if I'm not mistaken. And I believe you spoke a little bit about this last time. The way it's working is they'll give you a vaccine, and then they'll give you the second dose. But what they figured out in kids is they can mount an immune response with just one vaccine. So then they're trying to find the lowest dose to be able to give them enough immunity. Why it's affecting children now, I don't know. I don't think it's something that we know as of yet. Fortunately enough, we have a pretty robust response here in Texas, Texas Children's Hospital, or I'm sorry, TCH, and Driscoll Hospital. All those have good response to take care of kids, but still, I don't think it's something we should kind of take lightly, because any kid that can get infected can potentially have serious complications.
One of the complications that I did read about in regards to children, again, and you could maybe I read wrong, is that they could develop heart issues later on if they contract COVID-19 at an early age. Is there anything neurological or anything in regards to like heart failure or heart disease later on that we know of related to COVID-19?
Yeah, so it's pretty early to say if we're going to have lasting effects, but there have been some reports, and they have been finding different issues. For example, the heart, they've been finding that the virus does affect the heart, the lungs as well, for long-term sequelae, long-term effects. In the world of neurology, it's actually quite interesting, because in the last couple of months, the number of strokes have actually gone up, and most of the strokes have been secondary to COVID. So we don't know exactly what causes it, but what we do know is that it might be causing an inflammation of the vessels in the brain and in all the body, which is leading to the clots causing strokes, heart attacks, and what have you. I don't know if you remember, at some point in when this whole thing started, there was a lot of reports of like necrotic toes kind of going purple. So they found that there was thrombi micro, so very little clots that were kind of going to the little arteries in the toes or the little veins and clotting them off, closing them off, so there wouldn't be blood getting in or blood getting out. And the going hypothesis right now is that it affects the vessels, and that's why it causes those issues.
Well, a lot of mention has been made in regards to the treatment of individuals who have gone through COVID-19. We've had individuals on here that, pues, they've had a rough bout with it. We've had individuals that have had long-lasting effects from COVID, and other individuals, not so much. Why is it that it affects some people heavily and other individuals not so much?
So there's been a couple of studies into that, and one of the main things that's been discovered is that a lot of these people that are having really bad side effects or having lasting side effects are mounting or are having an exaggerated immune response, meaning you're responding more than you're supposed to. Your body's responding more. So it kind of causes an inflammation all over the body, which eventually leads to you having all the long-term sequelae and all the complications of the disease.
So it just varies from person to person.
Pretty much. I mean, right now at this point, we only have anecdotal cases, and they've been studied and everything, but it's too early into the disease to know actually what's going to happen in the next couple of years. There have been some reports of people that lose taste and lose smell. And some people do recover, some of them don't. We don't know exactly who will and who will not. That's kind of where we're at the moment.
Tested negative on December the 15th after 21 days of COVID. Wow. Was told I had to wait 90 days from my negative test to take the vaccine.
I imagine what they're just trying to make sure is that you are truly negative, because there's been some cases that initially test negative, but then they have all the symptoms, they retest and they're positive. So my best guess for that is that they just want to make sure that you truly are negative, instead of not giving you the vaccine at that moment.
I had COVID back in June. Do I still have the antibodies in my system? I think that there was a certain time frame that they had been mentioning. Is that the case, doctor?
So you'll some of these antibodies will remain in your body for a long time. We just don't know for how long they'll be protective, and that's sort of the issue with the with the vaccine itself. We know that it'll work right now. We'll know that it'll help right now. We just don't know how long that's going to last. Is this something that we should be concerned about? Not really. It's something that we should keep on our eye on, because, for example, influenza, we get a new vaccine every year, which I foresee I might have, or what might happen in the future is we might be getting a new vaccine every year or every couple of years, just depending on how things pan out.
It's just a matter of science. Then, as science progresses, then we might be able to fight a lot of these things. John makes mention that he lost his taste for 6 weeks. It's still to this day. And I think John tested positive, I'd say 2 months ago, 2 months ago, or 6 to 8 weeks ago, and still has not regained his smell. Is that something common?
We don't know the exact incidence or how often this happens, but people who do lose either smell or taste kind of have a 50-50 chance of getting either one back. Again, this is pretty much a brand new disease. We're kind of starting from zero. We know the family of viruses, so that's why we were able to act pretty fast on it. But we don't know 100% what the implications of infection are at this point.
Now, with a lot of the cases out there, doctor, I mean, we have a lot of concerns in regards to individuals coming together, and especially with the holidays and everything else that has been going on. Some of the recommendations that were given at first, have changed, have evolved as we have learned more about the COVID-19. And again, a lot of it is just based on hit and miss. Is that what we should expect for the next this year, the 2021, or have we gotten a better grasp in regards to where we're at?
I think at this point we have a better grasp at how we're supposed to treat, or how we're supposed to act as people around it, or as a population that's infected. What I mean by this is, initially when this started, I don't know if you remember, there was no N95 masks available anywhere. And the way it was working is, in the hospital, we would get an N95 and we would pretty much have to use that anywhere from 2 weeks to a month. Wow. The same mask. And these masks are made to be used once and thrown out, or at least in the healthcare setting. But what I'm trying to get to is, anytime you had any kind of access to a patient with COVID, you would wear an N95. But as of now, we know that a lot of the infection is through droplets. So N95s are now reserved for people who are taking care of patients who are either intubated or have to have some kind of process that will generate kind of like what they call it aerosolization. So kind of little particles of saliva and stuff like that could carry the virus. What I'm trying to get to is that we know what we have to do, and we know how we have to do it. What we don't know right now is what's going to happen with a person in a couple of years who had the infection right now. So that's why everybody's stressing still. Masks, distancing, and kind of pretty much take care of yourself.
Yeah, one of the things that we've shared constantly with individuals out there, it's a matter of us, everyone's out for themselves right about now. Is that one of the things that we continue to recommend? The best thing for COVID-19 is to stay away from people as much as possible, and to follow all the other CDC guidelines in regards to hand washing, hand sanitizer, face masks if you're going to have to go out there in public. I think one of the biggest issues is de que a veces nosotros somos cabezones, and a lot of it I think has to do because we don't want to let go. We're so accustomed to being so free and have so much freedom that we just, ya como raza, we just can't do it. We have to be in with other individuals, and it hasn't been helpful to our community. Es verdad que cuando te da estás inmune por 3 meses, ¿y cuánto por ciento es que nos volvamos a contagiar?
Eso es uno de los puntos que tocamos hace poquito. No sabemos exactamente cuánto dura la inmunidad. Lo que quiero decir con esto es que uno puede estar infectado ahorita Y nosotros no sabemos si la inmunidad va a durar de ahorita a una semana, de ahorita a un mes, de ahorita a 6 meses, de ahorita a un año. Hay algunos estudios que mencionan un periodo de tiempo, pero no sabemos exactamente cuánto va a durar.
Doctor, when do you estimate vaccines may be available for children under the 16 years of age?
So there's two ongoing trials right now. One of them looking at pregnant women pregnant women, and then the other one looking at kids under the age of 16. Again, the reason why we can't give the vaccine, the normal vaccine that we as adults get, is because kids can mount an immune response with a much lower dose. Meaning, if we end up giving them a higher dose of vaccine, they run the risk of having an exaggerated immune response. So, what we're trying to do right now is figure out what the correct dose for them is. See how we can. The idea behind this is give the least amount of dose that we can to each patient.
What helps relieve the pain of after COVID-19 headaches?
That's a bit of a loaded question. Reason being is there's a lot of reasons you can get headaches. I don't know exactly what the reason behind your headache is. Could it just be like because you were maybe sick? Then entirely true. Or you had some other kind of neurologic complication, or did you have headaches before this? So it's kind of a loaded question. I would suggest going to visit one of the neurologists, local neurologist, and try to chat with them, see how they can help you deal with the headaches.
Yeah, a lot of the and again, we always mention to everyone out there, guys, please consult with your doctor. They know you the best, the bestest. Do you think, Doc? Do you think it's a good idea for kids to be at school?
Um, so at this moment, I don't have any kids myself, so I guess I can't relate to how parents are really nervous, but I guess I do understand to some point. Is it a good idea for them to be back to school right now? I think it's quite difficult. On the reason being is we can still get an infection, and kids can still get infected. Would I wait to send them back to school? I probably would,
Yeah,
just to wait to see how things work out.
one of the things I think that we talked about, Dr. Garza, is that we're still dealing with a novel virus, and I think that's
Mhm.
what a lot of people haven't gotten the grasp of yet. We're still learning as we go, and one of the things that I think was very prevalent was how cautious every single doctor out there that has shared information, excuse me, all the way from Dr. Fauci on down in regards, guys, wait a minute, don't let your guard down. Be as cautious as you think need to be, because it's still a novel virus. And I think that's something that a lot of folks don't understand. One of the things that we had discussions with a lot of folks out there is they were saying, oh, Erasmo, you're focusing on the new cases, you're focusing on the positives out there, and you're not focusing on the recovered. And my take back then, which continues to be the same now, we really truly don't understand what recovered really, really means. I mean, back
Exactly.
then, recovered, what does that really mean? And then, we had individuals come on who had been experiencing the after effects of even after testing negative. I mean, they still had to deal with a lot of the issues that they had to deal with. John mentioned still being not being able to smell or to taste, ni me acuerdo. But to this day, I mean, we're still learning on it. See, doctor?
Yeah, so one of the big issues right now that we foresee in the next couple of years is, for example, when a patient has diabetes or has hypertension or anything like that, we know what steps we have to take to try to lower their risk of heart attack, stroke, so on and so forth. But we don't know exactly what to do, or what the best course of action for people who have been infected with COVID is. And it's not for lack of trying. It's because it's too early in the disease. You get these patients who have had strokes, and usually when a patient has a stroke and goes home, they either go home on aspirin, a statin, or another medication in addition to aspirin. But if these patients have a clot, now we're sending them home with anticoagulation, and we don't know what the best idea for that is, how long to treat. So we're kind of up against a rock and a hard place at this point.
100%. Doctor, and this is because as of recent, we know that there has been a couple of cases in Colorado. I read about one in California, possibly in regards to the new strain of coronavirus, hitting the states. Just today, I think I read in regards to it. They found it in New York, as per Governor Cuomo out there. Doctor, do we know if the current vaccine protects against the variant strains that are out there?
So what I've been able to read, or what I've been able to see right now, is that there's two new strains. However, one is the UK strain, and there's another one that just popped up today or yesterday up in South Africa, if I'm not mistaken. Are they the same virus? I don't know, because they haven't said anything about it. One of the health ministers from I believe it was Germany was pretty confident that the current Pfizer and Moderna vaccines should protect with this new UK strain. Although again, I don't know much more about that South African strain.
Yeah, and again, quién sabe cuántos más strains van a salir, but it's not a good thing.
Mm-hmm.
What's your professional opinion about last night's live where Vanessa was exposed as a crackhead by her ex-followers? I didn't watch the live. I do my best to stay away from those types of situations. It benefits no one out there. I mean, it's just National Enquirer kind of stuff. I mean, again, I pray for Vanessa. I pray for her family. I pray for her children. She's not going through a good situation right now. Hey, that's why, doctor. Hey, hey, me too. Very informative. Thank you, Tony. Appreciate that. Uh, yeah, Marisa's come back. We'll see. That's thanks. Oh, thank you, Gloria. Nope. Me too. No. Say the truth. No. Okay. Of the 2 and 3 vaccines available, which one, in your opinion, is the most reliable?
So, two vaccines that are approved right now in the U.S., Pfizer and Moderna. They each have between 90 and 95% efficaciousness. Which one do you want to get? I mean, whatever you have available. There's 3 other ones, Novavax, AstraZeneca, and I can't remember what the third one is at this point. Those are undergoing phase 3 trials, meaning hopefully soon they'll be available. But what I would suggest is, if you have access to either Pfizer or Moderna, just go ahead and get it. There was some concern about the Moderna vaccine kind of interacting with fillers in the past. I haven't seen any more information on that as of late, but again, it's something I would kind of touch base with your PCP, your primary care doctor. Then there was also concern about patients having experienced anaphylaxis, kind of like an exaggerated allergic response in the past to other vaccines. If you're a patient who has had anaphylaxis to other vaccines, it doesn't mean that you might not be able to get this vaccine. What it means is that you should get this vaccine in a professional care setting, meaning hospital, meaning an ER center that's ready to take care of you, not at a doctor's office or anything like that.
Thank you. Does your blood type, especially type A or AB, have a greater effect of how the virus attacks your body?
Initially, when this whole pandemic started, I know they were kind of trying to figure out, and I think it was linked to the type O, not so much A or A and B. I'm not entirely sure, but that research kind of stalled, or at least I haven't seen anything else. Research right now is focusing on vaccine and the effects, and actually what to do to avoid having patients to get intubated. get a tube down the throat.
Can we say at this point, doctor, that once a patient gets intubated, the percentage rate of recovery, well, of some form of recovery is very, very slim?
So I can't give you an exact number, but what I can do is if you get intubated, then it's getting complicated. I can tell you that situation is getting dire. There have been some patients that have been able to get extubated. When I was working the COVID ICU, out of 15 patients, we only had one get extubated, who was eventually able to leave the ICU. So I suggest don't get intubated, don't get COVID.
Yeah, don't get it to start off with, and you should be okay. And again, that's one of the things that I tell folks. As much as a lot of people think that I'm a very social individual, I do my best to stay as far away from people as possible. And again, it's worked for me. I did the antibody test. I think it was like 2-3 months ago, because family members of mine, they came out positive, and I was going like, oh, I wonder if I passed it on to them. And sure enough, never had COVID-19, Dr. De La Garza, and I don't plan ever to get COVID-19. And
Yeah,
I think,
that's the best thing.
and I think a lot of it has to do with, you know, I mean, just stay away from people as much as possible. And we all have to interact at some point in time. And if we do have to interact, again, protect yourself as much as possible and protect other individuals in your household as well by hand sanitizer, face mask, everything that they've required for us to do. Just do it. It's
Yeah,
not
exactly.
not a Nike commercial, but just do it.
Yeah, pretty much.
I think I have antibodies. So if I take the vaccine, will I have an overactive response?
Again, people who have had the infection before, it is recommended that they get the vaccine. And this is something that's coming straight from the CDC and the IDSA. The IDSA is the Infectious Disease Society of America. In conjunction between the IDSA, CDC, and the Pulmonary Doctors Association, the name escapes me at this point. They're the ones that have been kind of running the show, rightfully so. But I would recommend you contact your PCP and you tell them that you would want to get the vaccine.
I'm still dealing with the aftermath of 6 months post COVID. Yeah, 100%.
Exactly. We don't know exactly how long it's going to last.
Yeah, recovery seems to mean back from the jaws of death, but still all mangled. Yes,
pretty much.
Yeah, very much. It's going on to 7 months for me, and I still have problems breathing. Yeah, very much so. Hello, sorry I'm late. What are the highlights? Well, we're still here.
Get the vaccine. Don't get COVID.
Please. Do you think this mRNA method is more reliable and could change the vaccine industry moving forward?
I think it's not a new technology per se. It's been used before. But the idea behind this, or the advantage behind this, is it's giving the body pretty clear instructions on what it's supposed to make. I know at some point there was concern about the mRNA vaccine kind of going in and messing up with your genes and whatnot. But but just so you have an idea, basically the difference between DNA and mRNA. DNA is, I guess, the book that has all the recipes inside, but it's closed. Whereas the mRNA is kind of the recipe itself, that it's telling you what you need to make and how you need to make it. When you get this vaccine, you get the mRNA, but this mRNA doesn't go into the nucleus, which is where all the DNA is. So it's pretty safe in that sense.
Good. What are your thoughts about a growing number of children? Yeah, we mentioned the children part. Guys, very, very unfortunate. Again, ultimately, it's the responsibility of every parent out there to make sure that their child is as safe as possible. I mean, the responsibility now falls on all parents out there.
Yes, of course.
Doctor, in regards to they it was mentioned, and this is where we got to the questions. It was mentioned in regards to there being some issues with sterilization, with not being able to reproduce to have children. Is there any more information in regards to that?
Yeah, I've heard about that, but I haven't seen any concrete information on that. I mean, I guess you're just as liable to get sterilized by having somebody kick you in between the legs as you are by getting the vaccine, right? So, I haven't. I don't really think it's something that we should be concerned about at this point. I got my first dose on the 11th, somewhere around there, last on the 21st, and I'm getting my second dose pretty soon. So, I mean, I haven't grown an extra arm or anything,
Not
so
yet.
not yet.
uh, one of the things I think that we are experiencing here is that we are starting to get more and more vaccines come in. Again, there's still a lot of apprehension in regards to a lot of individuals out there, actually, wanting to get the vaccine. Again, we've been saying, guys, if it's your time to get the vaccine, get the vaccine. The cases in regards to where the ill side effects for individuals is they are very minimal at best. Is
Mhm.
that the case, doctor?
So the only side effect that I had was some pain on the injection site. My girlfriend got a little bit of numbness in her arm, but other than that, we've all been fine, no issues. Um, if people really knew what this virus does to you when you get infected and when you end up in the ICU or when you end up in a hospital, I don't think they would be thinking twice about the vaccine.
What about the veterans?
I believe the next group to get vaccinated is 65 years and older, and they're going to start that pretty soon, at least here in Texas. If by veterans you mean at the VA or older veterans, I'm not sure if they can kind of clarify that. I guess I can give a better answer, but basically, I also work at the VA here in Houston, and the VA has been pretty good with vaccinating all the doctors, all the healthcare workers.
Well, it's good. Yeah, I think right now at this point in time, we've had more and more vaccines come down to the valley. And again, guys, please register. There is a line to register. Uh, well, there's a website to register, and if you need help getting registered for them, please let us know. Please repost where to. Here's the question: where to repost? Where to register for the vaccine? Has it become first come first serve like in other states? Yes, and again, I've posted it again tonight. I posted it this morning. I'll continue to post it, and I'll continue to encourage everyone out there: register yourself and get ready for it. Doctor, is there any other information that would be beneficial to share out there with individuals in regards to what's going on?
I think the best thing everyone should do is just kind of watch their backs, not in the sense of being not trusting others, but taking care of what you do and how you do it, because you can spread this virus, and if it gets complicated, uh, you can end up dead.
And being dead is not a good thing.
No,
People use
not right
filler
now.
several years ago with the Moderna vaccine caused swelling and other complications. This was like 4 years ago. Do fillers stay in your body forever? Uh, and yeah, and if you have that information, that'd be great, doctor. In regards to fillers, I've read two different things. There was some social media outburst in regards to individuals that got Botox, but then I read that by fillers they were talking about something a little bit more substantial, like augmentations or the such. Do you have any information on that?
So Botox doesn't work the same way that fillers do. Some of the fillers, the way they work is they kind of draw water into themselves, and that's why they plump up the lips or wherever it is that they're put in. The way Botox works is it inhibits the transmission of a signal from one neuron to another, meaning it kind of blocks that transmission, sort of like a roadblock, I guess is the best analogy. Now, I do want to make a caveat here. Botox is not only for cosmetic purposes. Botox is used in a lot of movement diseases, Parkinson's, all those kinds of diseases. And it's also used, it's very, very good for patients with chronic migraine who have failed everything else. So Botox can sometimes get a pretty bad rap, and I feel like it's getting it because of COVID. But Botox is actually pretty good in the correct setting.
It did wonders for my forehead.
It was for headaches, I'm sure.
And yeah, Doctor, thank you so much for your time. We've gotten to our 45 minutes. Really, thank you so much for everything that you do. You know, y'all have probably the most underappreciated jobs out there as everyone out there in the medical field. But let me tell you that we're very, very grateful that y'all are out there. Even more grateful that you take up your time to come out here and inform. So again, thank you, Dr. De La Garza.
I'm happy to help.
Guys, thank you all so much for being here tonight. We've gotten to our 45 minutes. And again, guys, stay away from each other as much as possible. Face coverings, hand sanitizer, social distance. Guys, if you don't have to be out there, don't be out there. Guys, it's right now, everything dealing with COVID-19 depends on you, your health, and the health of those that God has entrusted in your care. Guys, God bless. See you tomorrow morning at 9 o'clock in the morning, where we'll be talking about Marisa Leal's lawsuit with BISD. Tomorrow morning at 9 o'clock in the morning, we will have that information, guys. I promise you. I know a lot of individuals were asking in regards to it. We'll have that information tomorrow morning at 9 o'clock in the morning. Guys, have a great, great evening. God bless. Guys, be good to each other. And please, 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 please be good to me. God bless.